Good day, beloveds. How do you do? Welcome to Talks from the Heart with Mandy, brought to you by Agape Wellness Coaching, a place where being begins at root. I am Mandy, a spirituality teacher and transformational relationship coach, as well as founder of Agape Wellness Coaching, and I'll be journeying with you, talking heart to heart. Welcome once again, beloveds, to another episode of Talks from the Heart with Mandy, where we explore the depths of spiritual and mental wellness, as well as personal growth and self-discovery in our relationships. I am your host, Mandy, still journeying with you, talking heart to heart. Beloveds, it has been a while since our last time together, and I apologize for my prolonged absence. As you all know, at Agape Wellness Coaching Center, we offer coaching programs, courses and workshops. So if I'm away from this platform, I am facilitating workshops and courses. To find out more, you can visit us at www.agapewellness-center.com. Again, it's www.agapewellness-center.com. Center spelled CENTRE, center. Once again, I apologize for my neglect, not having announced that I'd be away for as long as I have been. I appreciate your support. I see that you are still downloading, you're still listening to the episodes. I really appreciate that. And I thank you for your topic suggestions. They are great, and we will be exploring some of the topics that you have sent as good as I can. And yeah, I'm looking forward to still journeying with you. I really appreciate your support. Now, beloveds, as always, I encourage you to grab your favorite beverage, get comfortable, and settle in as we begin today's discussion. And whilst you're at it, do not forget to like, share, and subscribe, and turn on notifications so as to never miss an episode. Now, before we continue with today's episode, I'd like to start with a note of care. This episode, like all the other episodes shared by me on this platform, is offered for educational and reflective purposes. This episode, like all the other episodes that I share on this platform, is offered for educational and reflective purposes, as well as spiritual inquiry, and not to serve as a replacement for professional care. It is not intended to diagnose, treat, or replace professional mental health or medical care. If you or someone you love is experiencing acute distress, loss of touch with reality, or thoughts of harm, please, I beg you, please seek immediate professional support or emergency services in your area. I do not want this to encourage neglect. I do not want any of the things that I share on this platform to encourage neglect of one's mental health or your health, period. Okay? Now, with that out of the way, let's get talking. In our previous episode, we discussed spiritual awakening, the journey, spiritual awakening, that quite sometimes thunderous remembering of who we are beneath the roles, stories, and survival. Now, today, we walk a little closer to the edge of that mystery as we continue our exploration and discussion by learning how to differentiate between spiritual awakenings and mental breakdown, with our topic being awakening or emergency. Awakening or emergency. Now, most people who've traveled the journey of spiritual awakening or are going through the journey as we speak, as well as those working in spaces of caring for and supporting people who are going through the awakening and even mental illness, can tell you that it is very easy for most people to live undiagnosed, underdiagnosed, and or medicated when and where there is a misdiagnosis. That is why it is imperative that we have these honest discussions as we continue talking heart to heart. If you remember in our previous episode, inasmuch as I emphasized on getting the necessary care and support, I also stated that if one thinks that or knows that what they are going through is in fact a spiritual experience instead of a mental breakdown, I recommend getting care from a transpersonal psychologist or psychiatrist, someone who is well equipped equipped to deal with issues relating to spirituality if one knows for certain that what they are going through is in fact a spiritual experience. I know for a fact that most people can experience a spiritual experience at the same time as a mental illness or condition. So it is important to note that these two can coexist. That is why it is important that we get help. I recommend getting care from a transpersonal psychologist and or a psychiatrist who is well equipped in dealing with issues relating to spirituality, so that they will be able to help one explore the experience with more than just the pathological lens. Most often than not, spiritual awakenings may, and will mimic a mental illness. And that is why in most cases we see people misdiagnosed, heavily medicated. In some cases, people may not get the care they really need because they believe that what they are going through is only a spiritual experience, when they may be experiencing an awakening and a psychiatric emergency at the same time. The two can coexist. The two can coexist and be experienced at the same time. So that is why I encourage people to get professional support at the same time as spiritual support. I encourage people to get professional support at the same time as spiritual support. Okay, I know this may be frowned upon in spiritual communities, but I work with people, and in most cases, what may be a mental breakdown, what may be a psychiatric emergency, can be misrepresented by the person going through that, or even the support person, a caregiver. They may say it's a spiritual occurrence, it's a spiritual experience when it is a mental breakdown, as well as cases where a person is going through a spiritual emergency or a spiritual experience that may be mistaken for a mental illness. So it is important to get balanced care and support. We have to appreciate that not all awakenings happen as a result of one's deliberate and intentional spiritual practice. We have to appreciate that not all spiritual awakenings happen as a result of one's deliberate and intentional spiritual practice. Some spiritual awakenings are spontaneous. Some are spontaneous, and these are not like the gradual spiritual growth that occurs from one's intentional and deliberate participation in activities that may lead to one experiencing an awakening of their consciousness. These are spontaneous, and the spontaneous awakenings, again, do not occur as a result of one's engaged, deliberate and intentional spiritual practice that may lead to gradual spiritual growth that will then result in one experiencing an awakening of the consciousness. These spiritual experiences that are spontaneous, these spiritual awakenings that are happening at will, as spirit directs, randomly at will without our participation, more often than not are unexpected. They are unexpected, so they may cause disorientation, and when that happens, it becomes difficult for most people to grasp as fast as they should. It can be disorienting, and it can cause one to experience what would be deemed a mental breakdown. These spontaneous spiritual awakenings are unexpected and sudden shifts in consciousness where one experiences or senses that there is more to life than what they know or what they are. Now, depending on what the trigger is, the individual may experience a direct sense of oneness with the greater whole, God, the universe, or the ultimate reality without a full intentional effort or spiritual practice. Now, this experience is not necessarily a common theme. For some people, the spiritual veil is pulled to the side where they get a glimpse into the spiritual realm and they experience the spiritual realm. Sometimes it is dark, sometimes it is beautiful, leading to bliss. Now, imagine when you are the religious person or many other people that are so steep and steadfast in their religious practices, and they have no room for spiritual experiences that are not necessarily part of their religious framework or frame of reference, that do not form part of what they know as per their religious holy books. Imagine what happens to a person that experiences a spiritual awakening that is spontaneous and pulling the veil into the spiritual, and they experience something that isn't necessarily in line with their frame of reference as guided by their religious holy book. What happens then? What happens then when you see into the realms? And most people will respond with fear, being frightened. Then they experience dissonance that may, even at that very point in time, lead to a mental breakdown because they cannot necessarily reconcile what they have experienced when the spiritual veil was pulled to the side for them. That peek into the spiritual realm that they didn't necessarily expect can cause them to break down. And that is something that happens with most people who experience this spontaneous awakening. And for some, it is bliss. For some, it is bliss. They experience bliss. So no spiritual awakening is the same. Again, it all depends on the trigger of that awakening, especially if it's not gradual, if it's not from your deliberate and intentional participation in spiritual activities. It may be shocking. It may be something that causes dissonance. And depending on what one experiences and their spiritual experience, emergency can happen. Spiritual emergency can happen. So I urge people that when they find themselves in this situation, they must seek professional and spiritual help. These spiritual awakenings, spontaneous ones, are unexpected and they're sudden. So it is important that when you experience something like that, if it is not an experience that you can contain and navigate by yourself, please find professional mental help as well as spiritual support. Now, beloveds, it is important, again, to note that not all spiritual awakenings are going to be the same. This we must acknowledge. Not all spiritual awakenings are going to be the same. Some spiritual awakenings, particularly the spontaneous spiritual awakenings, they can be a profound, often intense incident and experience that can immediately alter one's perception, diminishing ego-centered ways of being and enhance one's sense of oneness, interconnectedness, and even having them experience bliss and inner peace. And then there's another person out there who gets an awakening and their experience becomes one that isn't necessarily peaceful, depending again on the trigger of that spontaneous spiritual awakening. You find that a spiritual door is opened to them where they experience a very dark side of the spiritual path. For some people, this experience becomes shocking, confusing, disorienting, especially for the religious. And we will label it a spiritual attack. We will label it as entering the wrong door. You have brought yourself to a place of evil. You have practiced evil and opened the door to the enemy. When you did not deliberately open that door, it was just a spontaneous thing, and that curtain pulled before you, the spiritual veil pulled before you, where you experienced the other side of the realm. And now, because these things that you saw are not necessarily in your holy book or covered within the framework of your religion, then you are either referred to as a mentally ill person because you were disoriented by that same awakening, or you were confused by what you saw. And that can lead to people breaking down because they're not receiving support or having a presence of a person who knows what goes on, right? And some people do not immediately get the courage to go through and pull through to the other side of light. No, they break down, they are paralyzed by fear and find themselves bound by fear, bound by what they are experiencing. It is important to note again that spiritual experiences, spiritual awakenings are not all going to be the same. Sometimes, for those of us who are believers, for those of us who are followers of the way, we know that some spiritual experiences are often deemed demonic because of their nature. And we turn around and say, it's a demonic attack. It is you having sinned and opened the door to a realm that you weren't supposed to be exposed to. And sometimes I must say that we fail people because sometimes the Holy Spirit, God will, by God's hand, pull the veil that we may see. It does happen. It has happened to many other people whereby you are in the church. Being in the church, God decides to pull the veil and you see the happenings behind the veil. You see the spirit behind the man, where you see the spirit behind the worshippers of the podium, where you see the spirit in operation. Some people do not make it out of that awakening whole. They walk out of that awakening broken, confused, wondering, where is this in the Bible? It is important that we do not fail people in spiritual, religious communities, and even the mental health profession. It is important that we do not fail people who are in need of support. There are times where God's self will want to unmask the wolf hiding behind sheepskin, the prophet, the prophetess speaking, and God decides, today is the day where I pull the veil, where my people will see the spirit behind the prophecy, where my people will see the spirit behind the worship, where my people will see the spirit behind this apostleship. And that spirit tends to be a spirit that is not of God. Do you want to tell me that a person who had that experience somehow sinned and opened the wrong door when the wolf in sheepskin is exposed? Do you want to tell me that that person having that kind of an awakening is in the wrong? That person is suffering a spiritual battle? Please tell me. I've had people come to me and share their experiences, needing support, spiritual support. When that happens, do we immediately institutionalize that person and say, oh no, you are having a mental breakdown? Do we medicate them? Do we cast them away and say, oh, you've sinned and therefore you somehow opened the wrong door into the spiritual realm and you experience demons, those demons are deceiving you? When the Holy Spirit or one's higher self sometimes opens the door for the person to see what's behind that. Because sometimes it's the same things that we deem sacred that can trigger the unveiling. And we deem them sacred because they are somehow disguised as religion, yet they are something else, right? So if that person enters the path into spirituality with that kind of experience that is spontaneous, they didn't ask for it, they were just there in the church attending, and God decided, I'm going to pull the veil today and I want my child to see what is going on up there. When an intercessor manifests a spirit that is not of God and they're laying their hands on other people and a child of God happens to have their eyes open, the veil is being pulled before them and they see what is going on. When that happens, do we cast stones at that person and say, oh, you're experiencing a mental breakdown, a demonic attack, this person is a fiery prayer warrior, this and that? Remember, sometimes even the fiery prayer warriors, even the pastors and whoever else aren't necessarily covering themselves as they should. They aren't necessarily fortified in prayer as much as they should. And certain things can sometimes visit and create a vessel of them. And at that point in time, a child of God may have their eyes open to see what is happening. And what happens is that we dismiss them as crazy. We dismiss the child of God as crazy. If it is not a blissful, inner peace, interconnectedness, oneness kind of experience, we dismiss it as crazy. We do not want to call it what it is, an awakening to what is happening in the realms. Now, I'm not saying that all of these experiences are going to be just a spiritual awakening. Sometimes it is what it is, and we need to deal with it as what it is. But there are instances like ones that I've mentioned where we dismiss them as mental illness or a spiritual attack, a spiritual battle. And sometimes we say, oh, it's a spiritual attack against the priest. It is an evil spirit trying to tarnish the name of the man of God and whatever. Not seeing things for what they truly are. Instead of praying for the one whose eyes were opened, instead of praying for the men of God to find discernment, to be strengthened in spirit, that such things may not create a vessel of them, instead of supporting all community members, we find one we can throw stones at. It is imperative to note that not everything that is intense is an awakening, as well as understanding that not everything that seems like a breakdown is in fact a breakdown. Not everything that is intense is an awakening, and not everything that breaks us is meant to destroy us. Sometimes a spiritual awakening can feel like a breaking, and sometimes a mental illness can be as intense as an awakening. Today's discussion is a very tender and necessary one. How to differentiate between spiritual awakenings, what we call spiritual emergence, and a mental breakdown, a psychiatric emergency. It is important that we understand these things. This is not a discussion for labeling. This discussion is not about labels. It is an episode about care. It is about discernment. It is about knowing how to differentiate between spiritual awakenings and mental health crises, especially in this time where there are many people who happen to have spontaneous awakening that are drug-induced, where drug addiction is at its highest, where people are suffering mental ailments due to many other factors. It is about knowing how and when to hold the experience gently and when to release and embrace the need for help, seeking immediate support as and when it is needed. Now, let us begin slowly. Why does this question matter so much? Is it an awakening or an emergency? Is it an awakening, a spiritual emergence, or a psychiatric emergency? Is it a mental health emergency or a spiritual emergence, awakening? See, in spiritual spaces, intensity is often romanticized. Visions are celebrated. Disorientation is framed as enlightenment. Silence is called wisdom. And yet, in clinical spaces, spirituality has historically been dismissed. Mystical language is pathologized, sacred experiences reduced to symptoms. So I wonder, have we ever taken time to put down the lenses and face the challenges? The challenge we need to face and acknowledge is that spiritual experiences and mental health crises can and may overlap. And honestly, we need to bridge the gap. We need to bridge the gap by providing integrative care, where both spiritual experiences and psychological vulnerability are recognized with the understanding that the two can coexist, and sometimes awakenings are just that. In 1998, Lucock, Liu, and Tanner proposed the term spiritual emergency, a stage or phase in the process of spiritual awakening where consciousness expansion becomes too intense and individual going through this phase needs support, where consciousness expansion becomes too intense and support is necessary. We all have to be aware that there is a very fine line between spiritual awakenings and psychosis. Again, I repeat, the symptoms may overlap, and when in doubt, it is only best to seek professional support. I cannot emphasize this enough. As a spirituality coach and teacher that is trained in mental health care, it is imperative that we bring awareness to the issues that we come across on a regular basis when providing support and care to others on their spiritual awakening journey. Again, I repeat that it is important to bring awareness to issues that we come across on a regular basis when we're supporting and caring for others on their spiritual awakening journey. Mental health issues may feel like an awakening, similarly to how spiritual awakening can feel like experiencing a mental breakdown. The line is so fine. The line is so fine that if we do not learn how to differentiate between the two, or even learn to extend out our hand for help, we may find ourselves in darker spaces, in very dark spaces. See, transpersonal psychology sits at the meeting point of these two worlds. Transpersonal psychology asks deep questions, and my plea to professionals is that they also take a moment to explore their patients' or clients' experiences with more curiosity and maybe put down the pathological lens for a moment. It is really disheartening that mainstream psychiatry will more often than not dismiss spiritual experiences or interpret them through the pathological lens, diagnosing them as mental disorders such as anxiety disorder, dissociation, or even psychosis. In some cases, even mistaken for schizophrenia, particularly in cases where the individual reports to hearing voices, right? So, again, my plea is to professionals to take a moment to explore their patients' or clients' experiences with more curiosity and be more willing to take a moment before pathologizing the experience of an individual. Transpersonal psychology is, again, the meeting point of these two worlds. It asks deeper questions. Questions such as, is this experience expanding consciousness or fragmenting it? Now, I want us to explore the cues clinicians and transpersonal researchers use to tell the difference. I know we have briefly discussed these in the previous episode, but I would like us to go through them once more so that before we move on our journey, we move with discernment. I want us to discuss this once more so that as we move on forward on our journey, we move with discernment. Number one cue is relationship to reality. Relationship to reality. In spiritual awakenings or emergence, reality softens, but it does not disappear. There is usually an awareness that this is happening within me. The experience may be symbolic, archetypal, mythic, but the person can still reflect, still question, still wonder. And in the case of a mental breakdown or psychotic emergency, the reflective space collapses. The reflective space collapses. Inner experiences are experienced as literal, external, unquestionable truths. The helpful question clinicians ask is, can this person reflect on the experience or are they consumed by it? A helpful question that most clinicians will ask is that, can this person reflect on the experience or are they consumed by it? And when that happens, we need to now sit with these and dig deeper and find a way of bringing this person to an awareness of what they are going through, right? Cue number 2 is meaning versus fragmentation. Meaning versus fragmentation. Spiritual emergence, even when overwhelming, tends to organize meaning over time. Spiritual emergence, even when overwhelming, tends to organize meaning over time. There may be confusion, but it slowly arranges itself into insight. There may be fear, but it is held within the larger sense of purpose. A mental breakdown, by contrast, moves towards fragmentation. Experiences feel chaotic, persecutory, or meaningless. The story does not come together. It falls apart. One expands towards coherence and the other disintegrates away from it. A spiritual emergence expands towards coherence and a mental breakdown disintegrates away from it. So these are some of the things that we need to look at. 3 is emotional tone and direction. Emotional tone and direction. Awakening is not always blissful. Like I said before, awakenings are not always blissful. Let us be honest about that. But its emotional range is wide. Awakenings aren't always blissful, but the emotional range is always wide. We must explore the spectrum, the emotional spectrum. Fear may arise, grief may surface, yet alongside them, there is often awe, compassion, love, and deep insight. In a case of a psychiatric crisis, the emotional tone narrows. The emotional tone narrows. Fear dominates, paranoia escalates, or the system shuts down into numbness. Clinicians look not only at the intensity, but at the trajectory of the experience. Clinicians will not look only at the intensity, but the trajectory of this experience. Is this person moving towards balance or away from it? Is this person moving towards balance or away from it? Number 4, functioning in the world. Functioning in the world. Spiritual emergence may temporarily disrupt life. Sleeping patterns, priorities rearranged, old identities loosened. But most individuals retain basic functioning. They can eat, communicate, ask for help, and care for themselves, even when it is imperfect. In a psychiatric emergency, what shows up will be different. A psychiatric emergency shows up differently. Self-care collapses, communication becomes disorganized, safety may be compromised. This is not failure of the spirit, by the way. It is a sign that immediate support is needed. It is a sign that support is needed. And number 5, relationship to the experience. Relationship to the experience. One of the clearest cues is how a person relates to what is happening. In spiritual emergence, there is curiosity, willingness to slow down, and an openness to grounding. In breaking down, there is fusion. There is fusion. I'm the experience. I'm this belief. I'm this experience. I'm this belief. No distance, no flexibility. Whereas when it is a spiritual emergence, there is curiosity, willingness to explore what this experience is and its representation, the willingness to slow down and an openness to grounding. That is what happens. Awakening invites relationship. Awakening invites relationship. A breakdown demands identification. And again, it's not just limited to these things. Hey, number 6, identity and ego structure. In cases of awakenings, the ego softens, but it does not vanish. In awakenings, the ego softens, but it does not vanish. There is expansion without annihilation, a sense of being more than before, not less. In the case of a breakdown, identity collapses without containment. The self fragments or inflates without grounding. In breakdowns, identity collapses without containment. Transpersonal clinicians ask, is self expanding or disintegrating? Is the self expanding or disintegrating? Cue number 7, time, integration, and outcome. Spiritual emergence tends to move in waves. Spiritual emergence tends to move in waves. With rest, support, and grounding, insight integrates. Compassion deepens. Life becomes more coherent, not less. In a case of a mental breakdown untreated worsens over time, insights diminish, suffering intensifies. Now, this is why early discernment matters. This is why early discernment matters. Beloveds, I'm not going to limit the cues that clinicians use to just what I have mentioned. I just mentioned a few of them so that you too can be able to discern what is going on, especially as a person who is supporting a person going through the crisis. So because we've discussed a lot of things in a very short space of time, I'd like for us to take a brief grounding pause, a brief grounding pause. Before we continue, let us pause together. Let us pause together. If you feel safe, place both feet on the ground. Notice the surface beneath you. Feel the weight of your body being held. Take a slow deep breath through the nose and a gentle breath out through the mouth. Now, name silently or aloud one thing you can see, one thing you can feel, one thing you can hear. You are here. You are grounded. And we can continue again slowly. If you feel overwhelmed still, I urge you to go back to the beginning of our pause and repeat the actions, repeat the grounding until you feel grounded and clear. And you can unpause and continue with us slowly. Beloved, it is important to say this clearly. It is important that I say this clearly. Spiritual awakenings and mental illness are not enemies. Spiritual awakenings and mental illness are not enemies. They can coexist. They can overlap. They can inform one another. A spiritual opening without support can become destabilizing. A spiritual opening without support can become destabilizing. A breakdown can carry profound spiritual material. The two are not enemies. The goal is not to spiritualize suffering, nor to pathologize awakenings. The goal is care, safety, and integration. The goal is not to spiritualize suffering, nor to pathologize awakenings. The goal is care, safety, and integration. When to seek immediate help is something to consider. If there is loss of reality, when you test and you realize that there is loss of reality, risk to self or others, inability to function, persistent terror or paranoia, then it is time to seek immediate help. This is not spiritual failure, not at all. It is a call for support. It is a call to seek help. Medical and psychological care can be sacred acts. Medical and psychological care can be sacred acts. So I want you to hold this truth close to your heart with the understanding that we cannot neglect self-care in the name of spirituality. Neither can we abandon spirituality in the name of mental health. The two are not enemies. They can coexist. And when we bring the two together, embrace them, marry them care of one's spiritual well-being and mental wellness can be sacred acts. Now, believers, as we come to a close of today's segment, let us hold one truth with particular tenderness, and that is seeking psychiatric care, medication, hospitalization, or therapy is not spiritual failure. It is not a spiritual failure. These can be secret acts of protection, of love, of responsibility. Perhaps the simplest way to remember this is spiritual awakenings expands consciousness and mental illness constricts it. One opens towards life and the other requires containment, support, and care. May we become communities wise enough to hold both. May we learn to discern without fear, and may no one ever have to suffer alone at the crossroads of spirit and psyche. Thank you for listening, beloveds. I appreciate all of your support, and I really am here to support you as you journey through the spiritual paths. Remember, Agape Wellness Coaching Center remains an extended helping hand, ready to help, serve, and support you on your journey to being the being that you are. And I really appreciate, again, your listenership, your visiting us, and journeying with us. Remember, this podcast show is available to you on Spotify, Apple Podcast, Google Podcast, YouTube, Amazon Music, and of course our website at www.agapewellness-center.com. Stay grounded, stay curious, stay kind with oneself, and remember, extending grace to yourself is not weakness, but strength. Seeking help is not weakness. It is understanding of oneself. It is self-awareness. As we've reached the end of today's episode, I say to you, stay blessed. This is your host, Mehdi, signing out until the next episode. Shalom.